Good morning, everyone, and welcome to this live event. I'm Marie Manning. I work in the Training Services Division of the American Red Cross, and I'm so glad that you're joining us today. I also want to let you know that we have a comment section here in this live event, and please, if you have any questions throughout or you have any questions about what our presenters will be telling us today, please just drop them in there and we will get to them either in the course of this event or at the end. Now, this live is a very special one because today at 5 a.m. Eastern Time, the updated guidelines for first aid written by the American Red Cross and the American Heart Association were released. This is the very first time we are hearing from the co-chairs of the writing group, also known as the people responsible for the team of medical professionals who are writing these guidelines. So these experts are here to make sure what and why you learn are backed by the latest science and medical evidence. So, having said that, I want to dive right into this session, but first I want to give you some background on our presenters. So I'm going to be looking at my notes here, bear with me. So the first guest I want to introduce today is Dr. Elizabeth Hewitt-Brumberg. In addition to being co-chair of the Guidelines Writing Group, she is the medical director of Emergency Department Emergency Preparedness and a family physician in the Division of Pediatric Emergency Medicine at the University of Pittsburgh Children's Hospital of Pittsburgh. She's also the assistant professor of pediatrics for the University of Pittsburgh School of Medicine in the pediatrics department. Additionally, she is a member of the American Academy of Pediatrics Council on Children in Disasters and serves as the vice chair of the First Aid Subcouncil within the American Red Cross Scientific Advisory Council. Dr. Hewitt-Brumberg is joined by her co-chair, Matt Duma. Matt is a clinical nurse educator and a resuscitation science expert. He works for Alberta Health Services in Canada. Matt has been an emergency nurse working clinically for nearly 20 years. He is currently a clinical nurse educator at the Royal Alexandra Hospital Emergency Department and an adjunct associate professor of critical care medicine at the University of Alberta. His clinical and research interests are in the areas of resuscitation and emergency department operations. So he's also perfect as one of the co-chairs of this writing group. We're so thankful that you were able to get up this early. Matt, I know for you, it's 7 in the morning in Canada. And so thank you for joining, and let's get started. So let's set the table for our viewers. Can one of you tell me what are the first aid guidelines and why are they important to us?
So the first aid guidelines are a comprehensive update of sort of all topics first aid, which contribute to education of first aid providers in North America. And this is the first time they've had a comprehensive update since 2010, although there have been focused updates over the last 14 years. And so it's a big document that covers a lot of topics that are going to update the science that goes into the courses that are provided to teach first aid.
Okay, so if I understand it correctly, the focused updates are smaller documents that touch on maybe 2 or 3 topics, focused, if you will. And then, but this one is the big document. I think you said earlier it was 158 pages and it addresses a wide swath of information. Yes?
Yes, thankfully, I think it's only 61 pages in the published version, but yes, it's a lot of different topics that kind of cover the breadth of first aid that first aid provider might encounter.
Okay. Now tell me a little bit about the writing group that you both co-chair. How is this group selected? And Matt, since Dr. Hewitt-Brumberg went first, we'll let you take this one.
Sure, absolutely. There were folks that were nominated. I think the leadership from the American Red Cross that did and American Heart did a really amazing job selecting experts in the different fields that inform such a such a diverse group of topics. It requires such a diverse group of people. So there's like emergency physicians, critical care physicians, paramedics, folks who've done lifeguarding, ski patrol, toxicologists, nurses, really people with expert in medical education, medical anthropology. Even there was a role for everyone on a team like this.
Okay.
That's really where our strength was.
Excellent. Yes, I know that there were 6 specialty areas. There's emergency medicine, wilderness medicine. That surprised me. We'll get into that. What areas did the wilderness medicine folks cover?
Oh, there are some great new topics on the care of cold injury, like frostbite, chilblains, hypothermia, things like that.
Excellent. Pre-hospital care, which is emergency, is EMS. Yes. Okay, trauma surgery, physicians, nurses, paramedics, medical directors, as you mentioned, and community educators. Tell me a little bit about the role of community educators.
Yeah, that really helps us take the science, which may not be very applied, and translate it down to principles that first aid providers and even lay people can use in their everyday settings. So that's super important for things like maybe overdose prevention and response, drowning prevention, things like that.
Excellent. Okay. So let's dig into the guidelines development process a little bit. Why is there a need for first aid guidelines? Why even do this in the first place?
I think that's a great question. I mean, first aid is the aid that somebody gets when they are first ill or injured. And we know that intervening as quickly as possible leads to improved outcomes. And we also know that people who have training to provide those sort of first aid behaviors are more likely to do it. And so, taking a look at the science every now and then to make sure that what we're recommending and training on is what should be done is really important to both make sure that people are learning the right things and also make sure that they're providing the correct skills in the correct order.
Right.
So I think, first aid is really, I think every single one of us has probably been a recipient of first aid at some point, and making sure that we're doing the right things is very important.
Right. Well, and Mark, one of our viewers, just wrote in. He says he's going to need to read the wildlife first aid guidance because he's teaching a course this weekend. So, Mark, you can find the press release and the fact sheet, which is an abridged version of the larger document that was referenced earlier. You can find that on redcrosslearningcenter.org, and Desley, our producer, will put that up on the screen and also in the chat. And then you can find the entire large document on the journal Circulation. Both were published at 5 a.m. this morning. So tell me how there were a certain number of topics that were chosen for the first aid guidelines. How were those topics chosen?
As a writing group, we have ties to the different organizations. Of course, the instructors that work with American Red Cross materials are often in touch with the organization to recommend areas that need to be covered. There are scientific advisory councils and roles for the organization where people, the experts in the science, keep up to date with what's being published and changes. And then also there are consumer changes, say like after the pandemic when pulse oximeters became a lot more accessible to people, and there's like new advances in availability of medical technologies. All those things sort of shape what needs to be in a first aid guideline. Okay.
And then how often are these reviewed and updated, and what triggers an update?
Oh yeah, that is a really good question. Sometimes a focused update will be required if there's a specific breakthrough in the science or some additional knowledge is made available. Furthermore, you'd have to it's good to do a comprehensive review like this, say every 5 years, to get a complete lay of the first aid landscape, to say what's relevant now that may need to be tweaked from previously. And then behind the scenes, there's also this continuous continuous evidence evaluation process going on, where the experts in first aid science are constantly reviewing articles, updating, and deciding, is this enough to push out a focused update, or can it wait for comprehensive?
Okay, got it. And so the last question about development before we dig into the guidelines themselves is tell me a little bit about the updating process. How do you translate this scientific evidence that you're talking about with the continuous evidence evaluation process, and how do you put it into practical first aid recommendations?
Yeah, so it's a laborious process. Um, so there are a few different approaches. So the International Liaison Committee on Resuscitation does a lot of what they call co-stars. The co-stars, which Matt, remind me what the acronym stands for.
Consensus on Science and Treatment Recommendations.
Thank you. And so they have reviewed a lot of those topics recently. And so that is an incredibly robust group of scientists. Matt is a member of ILCOR. So a lot of it, we can sort of jump off from there, but then we do our own literature reviews based on, sort of what's happened since that co-star was published. We look at what Other Science, AHA, and American Red Cross have reviewed. And then we sort of sit down, honestly, either on a Teams call or in a room together, and talk about how this could be applied to first aid. And I think, one of the things that is really a burgeoning place for development is more information about first aid application and education, because there's just a real dearth in the literature of application. It's a hard thing to study for sure, because we don't have researchers who are out there watching you apply a Band-Aid. So it is a hard thing to study, but a lot of it is thinking about how studies done by EMS and in emergency departments and by other trained providers could potentially be applied to first aid and first aid providers, or first aid people who are providing first aid in the sort of wild.
Okay. Okay. So we are just about halfway through our live event, and whether you were here at the start or joined in progress, we'd love to hear your thoughts, your comments, any of your questions, and you can just drop them in the chat box. We do have a question from someone who asked, if for first aid, did you look at virtual reality at all? And is there a portion there?
I'd say that for first aid education, virtual reality and augmented reality are two emerging technologies for reinforcing. And it's when our education review was done for teaching different methods for learning, it's definitely something that showed up. But like my co-chair Elizabeth was saying, it's one of these things that it hasn't been studied yet in a way that that we can be sure that it would be better than, say, in the classroom or psychomotor skill development or practice stations and things like that. But we think it's another great tool that continues to need to be researched, and that instructors and guideline developers can consider in the future.
Okay, great. All right. Moving along, let's talk about some of the most significant changes in the first aid guidelines for adults and children. I'm going to put the children piece to you, Dr. Hewitt-Brummerigh, since that's your area of expertise, and then adults to Matt. So let's start with the kids.
Yeah, so I think this is one of the first guidelines that's really had any sort of focus on pediatrics and kids in general. And so we had 3 pediatric emergency medicine physicians on the writing group committee who I think took a special eye towards each of the topics to make sure that if things needed to be different for children or babies, that we could incorporate that in. So I think one of the things we learned is actually a lot of the first aid treatment is the same. There are a few exceptions, stroke, hypoglycemia in kids who may not be able to chew things, those sorts of things. And then the approach to first aid needing to get consent from a caregiver, making sure that you're handling children gently, ways to talk to them. Those are all, pediatric specific things, but I think a lot of the treatment and the science itself is really the same. But it was good, I think, to take a look at those to just really make sure that we were incorporating such a large part of the population that may not have been particularly addressed before.
Okay. And Matt, how about for adults? What were some of the more significant changes?
Yeah, I think that just like Dr. Elizabeth mentioned, there's a bit of an overlap. We took extra care to describe what we think are the appropriate approaches for different people. So whether there's diversity in cognitive capacity and cognition, or whether there's age or sex and gender related differences, or people who are feeling extreme stress, it's really like empowering the first aider with approaches and techniques for taking care of different types of people. More on like the medical side, there's updates for the care of open chest wound. So that's classic first aid, sucking chest wound, penetrating trauma to the chest, how to care for those wounds, leaving them open, using chest seals, using non-occlusive dressings. Loss of emphasis due to the opioid crisis on opioid overdose. And, we had to provide specific effort to cover pulse oximetry and the use of oxygen in some special populations.
Okay. What do you think are some common misperceptions about first aid that the latest guidelines aim to address? I will let either one of you go. Although I do have a follow-up I may have follow-up questions on this. So, or was there anything in there that surprised you?
I think one of the big things that surprised me, at least, was a lot of the sort of topical treatment and the over-the-counter treatments that we, routinely use, that your mom tells you to use, that, we give to our own kids. There's really not a lot of data behind them actually working, which was interesting. So for things like poison ivy and, giving antipyretics for febrile seizures to prevent another febrile seizure, that's not effective. So I think there was less about what was useful and helpful and more about what probably there's no data to support the sort of the common knowledge that we would do that.
Okay.
So,
okay. Now, these guidelines focused a lot on the physical side of first aid. And Matt, I know you have a special interest in the mental health side of first aid. Do you see a future where that might become part of the updates?
I think it definitely is. And I think we've made important strides in that direction. I think with care of the first aid provider, a lot of this sort of like scene safety and being aware of the distress that can occur for the first aid provider from providing care in stressful situations. And then also for the first aid provider to going into, say, behavioral emergencies or mental health emergencies. I think this is an important incremental step. And I do see mental health taking a greater, portion or taking a greater significance in first aid guidelines.
Okay, and you talked a little bit about the first aid provider, and I know you'll be mentioning that again. By first aid provider, are you talking about EMS? Are you talking about people like me who might see something and need to respond? Help me define that.
Yeah, I mean, I think first aid is anybody who kind of responds at the point of injury or illness. In general, though, when we're talking about first aid, we're talking about quote unquote the lay responder, meaning somebody who does not have necessarily a duty to act, but who chooses to. So, and we say, these guidelines are up until the arrival of EMS or arrival to definitive care or the emergency is over. And so it's really for, they're for everybody who might come in contact with with a situation like this, but they're really geared towards being able to teach people with no medical background how to respond in these situations.
Okay, great. That I think is helpful to know. Probably a lot of our viewers today fall into that category. So, can you provide, let's talk about the guidelines and how, looking back at the history of the guidelines, how have they been implemented and improved first aid practices in real world scenarios? Um, Dr. Hewitt Brummer, does anything come to mind? I see you nodding your head.
I mean, I think the science and the guidelines are really important for updating training courses for a variety of different first aid sort of education classes. And so, like the Red Cross will use the science to update their training courses to make sure that we are at the same, we're providing the appropriate um, education based on what the science is telling us is the right thing to do.
Okay. And how have they, I am curious with your focus on children, have you seen them implemented over the years with children? Can you give us an example that you might have seen?
I mean, I think the Red Cross babysitting class is a great example. They really try to incorporate the most up to date science and think about things that a babysitter might encounter and provide education so that those kids who have taken that class are really, I think, much better prepared in an emergency to take care of the children who may be in their care.
That's really interesting because we are going to be having an update of babysitting coming out in 2025, and I, it'll be great to see that all of this new research made its way into that course. Um, so then, and that's just one real life example as we all go around and update all of our programs and our trainings. So let's talk about the long-term impact on public health and safety for both adult and children. Matt, I'm going to toss this one to you. What do you see as the long-term impact of these guidelines looking down the road?
What we see as first aid science advances, and then the really important implementation piece occurs when folks get trained as instructors and they take courses and then become providers, is that there's a public health benefit to this, that there are potentially survivable causes of death and disability that are out in the world from just living our lives, from getting suddenly acutely sick or getting injured. And first aid has a role when people are willing to respond to it, reducing the harm from those conditions, that morbidity, harm, mortality, death. And that's really where the impact of these guidelines come from, whether it's opioid overdose or if it's life-threatening bleeding. All it takes is a provider with a willingness to respond, who identifies there's a problem, renders aid, gets help.
Okay. First aid is a living, breathing thing. And yes, we have this moment in time today where we have these guidelines released. But let's talk a little bit about the future of the guidelines. Where do you see this? Have you already talked about what comes next?
I mean, I think there's always another update brewing. And so we've joked about it, but we're definitely, it definitely is. There will be another update coming. There is ongoing scientific evaluation going on at ILCOR, at AHA, at American Red Cross as part of the Scientific Advisory Council. This is definitely not, I mean, we're very proud of this document and these guidelines, but this is definitely not the end all be all of first aid. And I think there are so many things that we can continue to study and look at and improve going forward.
Well, you just got my next question for each of you, which is where would you like to see, is there a particular area that you'd like to see focus on as in perhaps the next update or the next overview of this? And so Dr. Hewitt Brummer, you've been nodding your head, so you go first, and then Matt, you go second.
I mean, I think I would love to see some more data behind the actual first aid actual first aid interventions. It is we made a lot of applications from pre-hospital, meaning EMS and emergency department, hospital, clinic settings to the first aid responder. And so it would be great if we could start to see a little bit more information about what actually happens in a first aid setting and being able to incorporate those into future guidelines. I think that's a really burgeoning area for research.
Mm-hmm, mm-hmm. And Matt?
I think really similar. I think the teaching methods, like maybe there's that augmented reality piece, what can be done by distance or pre-reading, what should be done in a skill station, how best to evaluate it. I'm interested in that education component. I'm interested in taking instructors and lay people and involving them in the process of reviewing the literature and coming up with the guidelines. Even more so, we definitely had responder and instructor input, but even more bringing people in. And then I'm also interested in all of these like emerging technologies. It's not uncommon to have a pulse oximeter at home. Lots of people have thermometers at home. And maybe what other sorts of tools, like maybe at-home little ECG strip readers, things like that. What their role
Apple Watches. Yeah.
Apple Watches, yeah.
Well, and there's a lot of discussion now where AEDs are being sold and people may have those at home too. So there's a whole host of technologies that are being involved. Speaking of technologies, this does seem to be heavy on the professional review and response. Has there been any discussion about the role of artificial intelligence in updating the guidelines? Has that come into play at all? Matt, I'm going to toss this to you since you brought up technology.
Oh, man. Yeah. So interesting, like when we started at the beginning of 2022, artificial intelligence was actually in a different place than it is now. In my work with other organizations that do these sort of literature reviews and evidence updates, yes, in the future, there's probably a role for finding and sort of meta synthesizing the literature. When we started out, no, there wasn't. And then I know from my sort of personal research, there might be some role in first aid providers accessing these devices, but they're not trustworthy enough at this point to go live. They're like a cool tool, an interesting technology that's emerging. But I think if you really still want trusted information, you're better off taking a course, going to the Red Cross now and getting trained.
Right. Okay. And to do that, it's redcross.org/take a class, and you could go and take a class with us and really dive into this and into the latest science. And Mark made a comment, a very smart comment. He said that the 2026 versions of the Red Cross first aid guidelines are only 2 years away. And that is absolutely true. They're already being worked on now. And this new science, these updates will be incorporated into that. So we've covered a lot here, and I'd like to take some questions from our audience. We have one from Lyle who asks where the complete guidelines document can be found on the Red Cross website. We have up right now on the redcrosslearningcenter.org, and Desley will pop that onto the screen, and it's also in this chat. And you can see the press release, you can see the fact sheet, and in the press release, you just click in, and at the very bottom is a link to the guidelines. They are published on the journal Circulation. So if you want to see the whole document, you can go to the journal Circulation, or you can you can see the abridged version on the redcrosslearningcenter.org. So Natricia just chimed in about AI skills. She said AI skills aren't widely known for it not to be harmful in this context right now. Thoughts on that comment?
Yeah, Elizabeth, I was part of a group that did a study of asking Siri, Alexa, like all these different tools, okay, Google, like, what do I do if someone's having a heart attack? What do I do for someone who's can't breathing? And yeah, the error rate was way too high. It was to be a trusted source of information to use in a first aid setting.
Got it. Okay.
One thing I will say though is if you're looking for something in your pocket to have for first aid skills, there is a great Red Cross first aid app that is informed by the science that you can download for Android or iOS devices, and that it does not link to Siri or Alexa as far as I know, but you can open it up and search for a topic if you're interested in either learning about it or need it in the moment.
That's actually a great point, Dr. Hewitt-Brumberg. I actually have the Red Cross First Aid app on my phone, and I have used it on occasion. I used it for a nosebleed, in fact, and it's very helpful. So you can just go to Google or Apple and pull it up in those stores, and it's simply the Red Cross First Aid app.
And it's free. And it's great.
Yes, it's free, which is great. Last question is whether there are any myths or outdated practices that the new guidelines aim to correct. I'm thinking maybe some of that wilderness stuff might be.
There is, I would say, no one's sucking out venom from a snake bite. We're no longer jamming things in people's mouths during seizure. Yeah, we are treating the absence of responsiveness and the absence of breathing or just gasping as an indication for chest compressions and CPR. Mm-hmm. So there are some in there.
Excellent. Okay. This is really great stuff. We've covered a lot, and I wish I had more time to spend with you. I really learn as much from these conversations as our audience does. So thank you for sharing this with us. And thank you for spending your time with us today. In the chat fields, you'll see how you can download the Red Cross app. It also includes the landing page for the app website or by what you can text. And Natricia said that she announces the app in every single class. So Natricia, thank you for being a Red Cross instructor and for helping get this life-saving information to people's hands. We hope you enjoyed this live event, and we will see you on future live events. Thank you, Dr. Hewitt-Brumberg, and thank you, Matt, for being part of this event and taking time out of your day and being, the first here to tell us what these guidelines are all about.
Thanks so much for having us.
Thank you.
Thank you.